In the realm of healthcare, safeguarding protected health information, PHI, is paramount. The Health Insurance Portability and Accountability Act, HIPAA, establishes strict guidelines on how PHI must be handled, particularly under the breach notification rule. This rule compels covered entities to notify affected individuals following a breach of unsecured PHI. However, certain exceptions and safe harbors exist that can significantly influence the obligations of these entities in breach situations. Understanding these provisions is essential for ensuring compliance while protecting patient data effectively. Exceptions and safe harbors in relation to HIPAA breach notification rule. To ensure the privacy and security of protected health information, PHI, healthcare organizations fall under the governance of the Health Insurance Portability and Accountability Act, HIPAA. The HIPAA breach notification rule requires covered entities to provide notification after a breach of unsecured PHI. However, there are exceptions and safe harbors that are important to understand in relation to this rule. In this tutorial, we will explore these exceptions and safe harbors in detail. Encryption exception. One of the exceptions to the HIPAA breach notification rule is the encryption exception. If the breached PHI was secured through encryption, meaning that it was rendered unreadable, unusable, and indecipherable to unauthorized individuals, then the data breach does not require notification. This exception highlights the importance of implementing robust encryption mechanisms to protect sensitive health information in a way that makes it unusable if intercepted. Unintentional acquisition, access, or use of PHI. The HIPAA breach notification rule also includes an exception for unintentional acquisition, access, or use of PHI by a workforce member or party acting under the authority of a covered entity or business associate. If the access or acquisition was made in good faith and not further used or disclosed inappropriately, then the breach is not considered reportable. This exception recognizes that not all incidents involving PHI access or acquisition should be classified as a breach, especially when there is no harm or likelihood of harm to the individual. Safe harbors. There are also safe harbors that may apply in certain situations, providing additional protection to covered entities and business associates. These safe harbors are based on risk assessments performed following a potential breach of PHI. If the assessed risk is determined to be low, the covered entity does not need to provide notification. Guiding factors for risk assessment. The nature and extent of the PHI involved, including the types of identifiers and the likelihood of re-identification. The unauthorized person who used the PHI or to whom the disclosure was made, whether the PHI was actually acquired or viewed, the extent to which the risk to the PHI has been mitigated. B4 criteria for risk assessment. I. The nature and extent of the PHI involved, including the types of identifiers and the likelihood of re-identification. I. The unauthorized person who used the PHI or to whom the disclosure was made. I. Whether the PHI was actually acquired or viewed. EV. The extent to which the risk to the PHI has been mitigated. If after conducting a thorough risk assessment, it is determined that there is a low probability of PHI compromise, the covered entity is not required to provide notification to the affected individuals, the media, or the Secretary of Health and Human Services. These safe harbors provide reassurance to covered entities, reducing the burden of unnecessary breach notifications while still ensuring the privacy and security of PHI. In conclusion, the HIPAA breach notification rule includes exceptions and safe harbors to provide flexibility in notifying individuals, the media, and HHS about potential breaches of unsecured PHI. The encryption exception and the unintentional acquisition, access, or use of PHI exception offer relief when certain circumstances are met. Additionally, the safe harbor provisions allow covered entities to perform risk assessments to determine if the probability of PHI compromise is low, reducing the need for notification. By understanding these exceptions and safe harbors, healthcare organizations can navigate breach incidents more effectively, ensuring compliance with HIPAA regulations while safeguarding patients' privacy and security.